Your own son, Drew, is a naturopath. Tell us about that. Were you
Oh,
instrumental in making that happen?
Well, sort of. I was given a PowerPoint when he was a senior in college, and I didn't know how to really do the computer back then. It was about 12 years ago. And I asked Drew to come to my grand rounds. I was director of medical education at my hospital, and about 90 doctors showed up. And Drew was working the PowerPoint with me. And he said to me, Dad, he goes, when the conference was over, he goes, you know, Dad, a lot of those doctors were angry. They really didn't want to be there. And my gosh, I don't want to be a doctor. I said, Drew, look, I said, whatever you want, but if you want to go in a healing profession, you know, there's other ways too. And that's when I suggested, look at Bastyr. And he went to the website, sent in an application, and got accepted in 4 weeks over the summer. So he went to Bastyr. He was a younger student in this class. He was only 21 at the time. And he did a 5-year program in acupuncture and naturopathic medicine. He actually did 2 programs. He was there for actually 6 years, learning both these disciplines.
You must be very proud of him.
Very proud of him. And I bounced off a lot of, you know, my own patients. When he was in naturopathic school, I was saying, hey, Drew, do you have a herb for this? Do you have a suggestion for this?
So you worked together.
Oh, we worked together, yeah. And then he gave me the incentive to really put together this MD, ND degree because, boy, when you have a naturopathic doctor trained in this discipline and a medical doctor here, oh, gosh, miracles can happen. Can you imagine lowering the cost of medical care where you can go to a doctor and instead of sending you to a specialist, he can handle everything? And if he's driven to a specialist at that point, his back is against the wall, well, then he can refer out. But we need primary care providers. And to have these people with dual degrees, I think it would plummet the cost of medical care in this country. They would be a one-stop shop.
And for children, too, when you say, I mean, there are a lot of kids now on drugs, kids with ADD, ADHD, and it seems that the easy and ready solution is to put them on any number of drugs. And in most cases, these kids never see any other type of physician.
Exactly.
Is it your view that if these kids saw doctors who practice both, that maybe fewer of these kids would be on medication or fewer of these kids would be on less medication?
Absolutely. Look, a typical pediatrician, and I'm not putting down pediatricians, when a kid develops a hot ear, they're going to go to an antibiotic. You bring that same person to a naturopathic doctor, they're not going to use an antibiotic. They're going to put cotton in the ear and put iodine drops in the ear. That's what they're going to do. Or they're going to use some different herbs or different, you know, nutraceuticals. If they have to go to antibiotics, they will. So I would say even a pediatrician, if they went to naturopathic school, you know, it could be a pediatrician, it could be a surgeon, it could be a medical doctor, it could be even a cardiologist. I know a cardiologist who went to naturopathic school and also did his cardiovascular training. So I think that's the best discipline, and I just think this is what our country needs.
Give us a real life scenario of where these 2 disciplines actually help to save the life of one of your patients.
Well, I mean, knowing what I know now, I mean, I could probably get an honorary naturopathic degree because I've been practicing alternative medicine for 3 decades now, 3+ decades.
You've been way ahead of the field.
I mean, a typical example is this. I would have patients with, you know, big-time cardiovascular disease. And let me give you an example. I'd have a patient with angina, okay? And they've been bypassed, they've been stented, they're on medical therapy, they're on my nutritional therapies. And all of a sudden, they're getting angina, they're getting panic, they're getting anxiety, which is a big factor in patients with cardiovascular disease. You know, these people are afraid. They're afraid of a heart attack. They're afraid of sudden death. All these things cross their mind. So instead of asking these patients, you know, to calm down, don't worry about the fear, you can't do that. You know, some of these patients I would put on Valium, you know, some of these tranquilizers, but that's not a good thing either. But knowing what I know now, which I learned from naturopaths, I'd put them on Bach flower remedies. I would use white chestnut or rescue remedy. I would use a tincture of the Bach flower remedies, ask them to put it underneath their tongue, and all of a sudden, their anxiety and panic would go away. That's an example of blending the best of both worlds. I can't tell you how many times I prevented patients from going to the emergency room with panic when they took Bach flower remedies under the tongue. So that's an example of bringing naturopathic medicine with conventional medicine to the table.